Tibetan Cancer Society works for control of cancer by generating cancer awareness and cancer detection program. During the unprecedented COVID-19 crisis, they have been actively engaged in helping those who are in need of healthcare services. For more information, we are joined by the founder and director of Tibetan Cancer Society, Tsultrim Dorjee. Tsultrim Dorjee, it's really nice to have you on Tibet TV. Welcome to our show.
Thank you.
Tsultrim, Tibetan Cancer Society generally works towards the prevention of cancer in a society. But since COVID-19 cases started to rise in India, you and your team were seen dedicating yourselves to aiding the ones who are affected, particularly during its second wave in the country. Tsultrim, can you tell us how has Tibetan Cancer Society been working as one of the leading teams in providing support during the pandemic?
We as the Tibetan Cancer Society are mainly focused more on cancer patients, particularly to cancer patients. But after procuring ambulance from the Tibet Fund, we are generally providing emergency services to all, irrespective of any cases of any disease or anything. But during the second wave occurred, for the initial time, we are catering our ambulance services to any emergency patients required. So, for example, we are basically bridging the gap between home to hospital. So we are responding to any emergency calls during this pandemic. So we are also helped many patients from Delhi to Dehradun, even one patient from Dharamsala to Chandigarh also. During this pandemic, in the initial times, our ambulance services almost run 24 hours a day. So we are particularly exchanging drivers, we are exchanging team, but we are working throughout the day and night.
Tsultrim, like you just mentioned, saying that when this pandemic happened, you are not just focusing only on the cancer patients, but also to all those who are affected by any disease, So isn't that causing any disruption in what you normally do, that is protecting people from cancer and creating cancer awareness?
We have already dropped out a plan to conduct various cancer awareness programs and camp at different settlements. But due to the lockdown, due to the pandemic, it's not possible to do that. And further, we do have cancer patients residing in Delhi. So for them, we have a special nurse for them to address the cancer patients. But unfortunately, most of the cancer patients residing in Delhi were suffered COVID-19.
You and your team, which is also called the COVID Core Group, had also initiated in providing free meals during the lockdown. The initiative was called the Meals for Invisible. So, Tsultrim, what do you mean by invisible?
It was happening in the first, first COVID wave. That was last year. During that time, I was a part of a core group. It was led by Kungo Pinsula that set in office, Delhi. With Kongla directions, or we get to visit a lot of different places. Tibetans residing in Delhi. So Tibetan in Delhi, not just in Majnugatila, in Punjab, also South Delhi, North Delhi, all these places. So I went to survey on behalf of settlement office, and I've seen a lot of Tibetan youngsters who were involved in this drug addict. So by invisible, I mean drug addict, substance abuser, sex worker, and a destitute alike. So for them, I believe that despite we know this, that they exist, but we put there's a strong stigmatization prevails within our exile community that they are like the rotten tomatoes or rotten vegetables that need to be kept aside in order to prevent kind of disease. They are not a disease. They just have a wrong path. Other than that, they are also human beings. They're also Tibetans. They also have a chance to grow as well. In fact, they are not invisible, but we make them invisible. The project was funded by the Tibet Relief Fund, Ms. Philippa Carrick, the Dalai Lama, Tibet Relief Fund whole team. So we provided a meal for 2 month period last year, and it helped them a lot. Because the thing is that giving more money to them, the drug abuse and all these things, they will misuse it. So if you give a dry ration also, they don't have a place to cook as well. Every day there's a different menu. So we are providing a good meal for 2 months period, and it really helped them a lot.
That's wonderful, Tsultrim. And after initiating Meals for Invisible, you also came up with a plan to set up community kitchen at Majnu Katila in New Delhi. Tsultrim, can you tell us more about this project and why did you feel that there is a need of such kitchen?
Community kitchen is basically just derived from the Meal for Invisible. Although, we did provide a meal for Invisible, we did provide a meal for the 2 months, but that doesn't enough. That doesn't suffice because the thing is that they need care, like they need food every day. Our team responded to one of the emergency cases that occurred in Punjab, and he was merely 32, I guess. So and he passed. And while I was in the cremation center, I saw him in person. He was really, really skinny. And I really felt that, if he get the food, he may not have passed. He may get a second chance also. I have witnessed, particularly witnessed, there are people who were drug abusers, but now they have changed. He's doing a good business, he's earning a good living, and he's working really well. There are a lot of examples like this. In order for them to live, they need to eat well. While consuming such drugs and all those things, but they need to stay healthy at the same time. So by providing a meal, it will help them, right? It will help them maintain their health. So during the ways, and they will come to know that they have choose the wrong path. So it's totally dependent on the individuals. So that's the reason why we put up this community kitchen so that they can come anytime. So we are providing meals, breakfast, lunch, and dinner every day, maybe 1 year now. So we're planning to continue this project forever. In Delhi, they're not just regarding addict or drug addict or anything. There are sex workers too. There are a lot of prostitutes as well. So we'll be providing meals for all free of cost. Apart from providing a free of cost for them, we're also initiating like the cheap, right, affordable meals for others. There are a lot of like daily wagers. There are a lot of celebrate, Tibetan employees residing in Delhi. They can also, get benefited from these community kitchens. The community kitchen project is entirely funded by the Tibet Relief Fund. Although we are planning to spend some fund from our COVID-19 fund to the community kitchen project, but the rest of the expenses are bear by the Tibet Relief Fund UK.
Since you have been traveling a lot, trying to reach all the possible Tibetan settlements across India, how are you maintaining the precautionary measures and what kind of challenges have you been facing?
We are trying to follow all the COVID protocols, like wearing masks, proper masks, sanitizing ourselves, putting disinfected sprays all over our bodies while visiting any places to different settlements. The biggest challenge we face is that, so while traveling, most of us have nausea problems, vomiting sensations, because the thing is that while traveling in the hilly areas, you have to climb up and you have to climb down, so it's really difficult. At the same time, on the way to the destinations, you don't get to stop on the way, because the thing is that, due to the earlier lockdown, so you don't get to eat on the way. So you have to travel until you reach the destinations. So most of the times during our travels, or lunch where sometimes around 4 or 5, or sometimes our dinner we get to eat it by 12 midnight. We didn't rest much because the thing is that we hardly slept properly because next morning we're just traveling. So while we reach Dharamsala, we get to rest proper. We get to get good rest. Apart from this, getting rest and just getting light was difficult.
How busy are you, Tsultrim?
Actually, before I'm really busy. Now also pretty much we are occupied because we have a very small team. So we have to manage with accounting and all those things. Apart from this, right now, as per our plans, we have to go to northeastern Tibetan settlements and the south also. And further, we are also planning to help those who need. Now, suppose for example, pretty much in Delhi, the COVID second wave has pretty much come down. But in other states and some other rural Tibetan settlements, they may have faced problems. So we are planning to visit that place and help them. So we are planning to check out all these things. That's what we're doing now.
So Tsultrim, how are you managing financially?
From the beginning, Tibetan Cancer Society is run by myself. So we don't have any funders. We don't seek donations. Pretty much thing is that I never planned to continue this Tibetan Cancer Society by myself because I work in a cancer NGO. So I helped. I just wanted to do the biggest things that I felt. There are in the world. There's everywhere in the world, you just compare any country, they do have a cancer NGO working for the prevention of the cancer and all those things. But unfortunately, in our communities, we don't have any. because I never heard about cancer awareness program. I never heard about cancer reduction camps, nothing. So I felt it's really important to have one in our communities. So that's why we founded these very organizations. And later I felt that, I can hand it over to CTA so that they can continue this program, these organizations after registering and all these things. But, the former CEO of the Singhala told me to continue these organizations by myself. So that's how we continue this society until now. So eventually, by the end of maybe 2018, the Congo Indala, the Tibet Fund helped me. So they start funding us, our program and all these things. And now we have three funders. Tibet Relief Fund is also one of the big funders we have. We have an MOU with Tsultrim Dorjee also. He's helping us with administration costs, compassion forms, expenses, and all these things are there by Tsultrim Dorjee. In fact, Tsultrim Dorjee also helped us during the Meal for Indivisible program too. Last year, during His Holiness birthday, we distributed food to 1,000 more people. So we have three good funders: Tibet Fund, the Tibet Relief Fund, and Tsultrim Dorjee. That's financially. And regarding the COVID fund now, we receive a huge fund. Further, we have spent more than crore rupees. And so we're planning to help more communities. We have already covered Dehradun, Dharamsala, Ladakh, and all these places. We also already gave them oxygen concentrators, nebulizers, oximeters, and all these essentials medical care needed to guard a COVID-19 third wave. So further, right now, we are trying to travel to northeastern state to help them, and to South Indian also. We're trying to pretty much cover all the settlements.
So, Tsultrim, how did you feel when you and your team's work was appreciated by His Holiness the Dalai Lama's office, and you also received a donation of 1,10,000 rupees? How did that make you feel?
That was the best moment of my life. When I received this letter, I was like, I got goosebumps all over. And when I shared the news with my team member also, everyone got goosebumps. So we all are thrilled to receive a huge letter from His Holiness office. But at the same time, I felt it is not just meant for us. I think it is meant for all the COVID-19 workers, front-end workers. It's meant for all. And I think that we as an organization, the small organization, we don't need more. This is the biggest certificate of our organizations. And this is the biggest realization we received so far.
Tsultrim, I really like how you are so creative with your initiatives. The reason behind Meals for Invisible or setting up community kitchen in Majnuka Tilla in New Delhi only shows the compassionate nature of a Tibetan. I would like to thank all your team for putting in so much effort, especially during the second wave of COVID-19. And thank you so much for speaking to us, and please keep up the good work.
Thank you, ma'am, for inviting me.
Today marks the 100th episode of In Conversation with Tibet TV. We would like to thank all our viewers for continuously supporting us. Thank you for watching, and see you next week.